Let's start.
Okay. Good morning, class. Good morning, sir. So we are
Go back.
we are cluster one for Eckert's
Go back.
Emmanuel, Emmanuel General Hospital, Eckert's,
Louder.
and okay, we are students of cluster one, Emmanuel General Hospital of Eckert's, and we are handling a case on a patient, Mr. AG, who is 57 years old, and he's an Indian taxi driver. He reported to the community pharmacy and he presented a prescription of nitroglycerin or glycerin trinitrate sublingual spray, 400 micrograms to be taken as needed. And his general practitioner prescribed that medication for him because of the symptoms he complained of, chest pain and chest tightness. So his practitioner actually thinks he has um, angina, so he prescribed that. So he reported to the pharmacy, and then we actually showed him how to use the spray, and then he went home. Later on, he reported back complaining of headache and said that this headache started after he took the glycerin trinitrate sublingual spray, and so he wants to discontinue the medication. So the first thing we did was to establish a professional and therapeutic relationship with the patient. And so we got his information, his details as stated, his name, his age, his ethnicity. I also got his history. Then the next thing we did was to identify subjective and objective data. So the subjective data he presented with was the headache, and additionally the chest pain he complained to his general practitioner as well as the chest tightness.
Okay, let me pause you people at that point because some of the case studies are, they have explained. So let me know what are the drug therapy problems
Okay, the
uh,
first
that you identify.
Okay, the first drug therapy problem there is an adverse reaction due to the glycerin trinitrate sublingual spray that he's actually using. He complained of headache, and according to MDEX 2024-2025 page 265, throbbing headache. Throbbing headache is actually one of the symptoms of sublingual glycerin trinitrate, and so that was the problem, an adverse drug reaction, and that was why he came to the pharmacy for us to resolve it. And the plan we used to address that case was to give the patient paracetamol or recommend paracetamol 1 gram to be taken 3 times daily to manage the pain. And that management scheme is also in line with what is suggested in the MDES. Then that was the problem. We also discovered a health problem too with respect to his lifestyle, which is the fact that he smokes cigarettes 5 sticks weekly, and
Okay.
then he smokes cigarettes 5 sticks weekly, and then he's also a taxi driver, so he lives a kind of sedentary life, and then his ethnicity too as well also predisposes him to having angina,
So drug therapy problem one is what?
um, adverse drug reaction from glycerin trinitrate.
Second one was what?
There is no other one. Sir.
There is no other one. There is no potential or actual. I mean, potential adverse effect.
Yeah.
Ah, all right.
Okay, okay. Due to the fact that our patient is advanced in age, it actually exposes him to he one of the risk factors of angina is increased age. Although he's not up to 60 years as stipulated, but his risk is actually still within the same margin as well. Also, due to the fact that the the patient smokes, he's exposed to developing angina. So, yeah.
How does smoking relates to angina
Okay.
at the molecular level, not macroscopic? Let us know the molecular mechanism of smoking to angina.
Okay. When a person smokes, um, there is increased risk of damage to the blood vessels. Now, when there is damage to the blood vessels, there could be deposits of materials like cholesterol. Now, when materials like that are deposited, um, it could lead to the lining of the blood vessels will be reduced. Blood cannot easily flow to the
Have you
heart.
smoked before?
No, sir.
No, because it's somebody that smokes that we know. Have you smoked before? Small. Okay, answer that question. Because it looks like she has not smoked before. How does smoking relates to, because you say is a what? It's one of the risk factors. So I want to understand the that molecular association.
Actually destroys
Louder.
smoking actually destroys the wall of
Are you hearing this man? From the back. Talk, let them hear you.
smoking actually destroys the uh, all of the matter.
One of the what?
Myocardial artery.
Smoking does what?
It destroys the myocardial.
I want to know how this comes about. What is that again?
Okay, let me.
You know you are live TV. How this opinion on live TV so
Okay,
that they see what you are doing.
okay. When a person smokes,
Transfer it to your parents' mom.
when when a person smokes, mm, like whenever you inhale whatever or you take in whatever, like inhale or smoke something. Now it is exchanged. There is a membrane between the respiratory and the blood. Now, when a person smokes, this membrane is actually damaged, which hampers the exchange of oxygen between the blood and so the movement of carbon dioxide and oxygen is actually hampered during this activity.
So continue. That's a great one. But get to the point of impact.
Okay, so when there is reduced, when this oxygen cannot move into the blood, that means the required oxygen that the blood needs to carry to the heart is actually reduced. That means it can precipitate angina for the patient.
Yeah, that you can. That's how you can. That's it. What did you want to say? Okay, it's not correct. It's not correct. Yeah, smoking automatically reduces oxygen concentration within the pulmonary system. Is it not so? Yes. And when it reduces it, you have more of carbon monoxide, carbon dioxide, all there displacing oxygen, and then hypoxia. Yes, go. It's affected. All right. So I think that's okay for now.